Now, specifically when we talk about neutrophilia, where there is an increase in the neutrophil count in the WBC, from the WBC cells from its normal reference range. Causes will be commonly due to any acute bacterial infections or bacterial pneumonia. It even occurs in response to fungal, parasitic or early viral infections. Also occurs in inflammations due to autoimmune disease, any tissue damage occurred after surgery, burns, myocardial infarction or traumatic injury, acute hemorrhage or hemolysis, metabolic disorders like acidosis or uremia, and in certain drugs, toxins or chemicals. In all these scenarios, your neutrophils can increase from its normal reference range. So, when an infection or any pathology happens, what happens is the bone marrow is stimulated to release increased amount of neutrophils at a faster rate, and this produces it causes the release of them in a more immature stage, which is called as the left shift. And when you understand this left shift, the degree of left shift and severity of neurophilia emphasizes the severity of the infection. Now, there is something called as pseudo-neutrophilia. That is, it is a physiological neutrophilia. That is, increase in neutrophils that is due to physiological changes. We have early spoken about the marginal neutrophils and the circulating neutrophils. When the marginal neutrophils shift to the circulating pool, and when it is counted in the CBC, in the marginated neutrophils, they will be it will be very immediately increasing the CBC count and transient, and it will last only for a less than an hour. And because they are immature cells and no spikes in band type cells, that is when there is a left shift increased. This as seen in a pathological neutrophilia, but it is not due to any pathology, then it is defined as your pseudo neutrophilia.